Hello, my dear nursing aspirant. I, Angeline.P.Tirkey, welcome you all in APT online nursing classes. And today we have come with the Norcet 2020 previous question paper solved. Yes, my friends, in this video you will be getting 15 question sets which has come previously in Norcet 2020 exam. My dear nursing aspirants, if you haven't subscribed our channel, do subscribe APT online nursing classes for more further previous question paper sets and further videos. Let's start with the first question, that is question number 1. Pap smear test is used in the diagnosis of. Yes, pap smear test is used in the diagnosis of, and the answer is it is used in the diagnosis of cervical cancer. Yes, it is used in the diagnosis of cervical cancer. Pap smear test is also known as a pap test. Yes, इसका दूसरा नाम pap test है, and basically it is a procedure which is used for the diagnosis of cervical cancer in the women. Basically it involves collection of the cells from the cervix, that is the lower narrow end of the uterus, and from the top of the vagina. So basically in the pap smear test क्या होता है, there is a collection of the cells which is done from the lower and narrow end of the uterus and top of the vagina. So pap smear test is done for the diagnosis of cervical cancer. The next question, question number 2 says, ATRIO-venous fistula is assessed for. Yes, the answer is it is used for the assessment of patency. Yes, it is used for the assessment of patency. Basically ये आर्ट्रियोवेनस फेस्टुला जो होता है, it is an irregular connection between the artery and the vein. Vein and artery के बीच में जो irregular connection होता है उसी को हम आर्ट्रियोवेनस फेस्टुला कहते हैं. यूजुअली जो ब्लड होता है वो फ्लो करता है फ्रॉम द आर्टरीज टू टाइनी ब्लड वेजल्स कैपिलरी के द्वारा एंड देन ऑन टू द वेन्स. बेसिकली ये आर्ट्रियोवेनस फेस्टुला के टाइम में क्या होता है, ब्लड फ्लोज डायरेक्टली फ्रॉम द आर्टरीज इनटू द वेन अवॉइडिंग सम कैपिलरीज. कैपिलरीज में ब्लड कैपिलरीज के थ्रू नहीं जा करके ये डायरेक्ट ब्लड का फ्लो होने लग जाता है आर्ट्रियोवेनस फेस्टुला के टाइम पे. So basically arteriovenous fistula is used for the assessment of patency. The question number 3 says scrubbing will be considered as. Yes, scrubbing will be considered as. Yes, the answer is physical disinfection. Scrubbing को physical disinfection की तरह consider किया जाता है. Basically scrubbing एक ऐसा process है जिसमें कि it is done to rub something hard in order to clean, especially using a stiff brush, soap or a water. बेसिकली स्क्रबिंग हम देखते हैं ओटी से पहले और इवन बिफोर एनी सॉर्ट ऑफ सर्जिकल प्रोसीजर स्क्रबिंग इज बीइंग परफॉर्म्ड एंड इट इज अ फिजिकल डिसइंफेक्शन. यस, स्क्रबिंग कम्स अंडर द फिजिकल डिसइंफेक्शन. Question number 4 says most painful type of burn. Yes, most painful type of burn. Yes, my nursing aspirant, the answer is second degree burn. Second degree burn is the most painful type of the burn because it is a partial thickness burn. Yes, second degree burn जो होता है, it is a partial thickness burn and basically it is one of the more severe than a first degree burn. It basically affects the outer layer of the skin which is known as epidermis. Yes, in second degree burn में क्या होता है, outer layer of the skin get affected and the part of second layer of the skin that is called as a dermis. Both epidermis and dermis जो layer है हमारे skin के वो इसमें क्या होते हैं, affect होते हैं in the second degree burn. Second degree burn is very painful and it takes several weeks to get healed. Yes, second degree burn क्या है, it is the one of the most painful type of the burn. Question number 5 says side effect of clozapine include. Yes, side effect of clozapine. Basically ये जो clozapine drug है, it is used for the treatment of schizophrenia. Yes, it is used for the treatment of schizophrenia and the side effect for this drug is agranulocytosis. Yes, agranulocytosis is one of the common side effect which has been caused by clozapine. Basically agranulocytosis के time में क्या होता है, the patient will be having fever, chills, weakness, sore throat, sore in the mouth or throat, bleeding gums, bone pain, low blood pressure, fast heartbeat, and a trouble breathing. Yes, so these all are the side effects of the agranulocytosis, and agranulocytosis is the side effect of clozapine drug. Yes. Next question is question number 6, that is nicotine replacement therapy is used for. Yes, nicotine replacement therapy is used for which condition? So nicotine replacement therapy is used to treat the people to stop smoking. Yes, for smoking cessation के लिए nicotine replacement therapy का use किया जाता है. Basically, it uses the product that supply a low dose of nicotine. These products do not contain many of the toxins found in the smoke. The goal of this nicotine replacement therapy is to cut down on craving for nicotine and ease the symptoms of nicotine withdrawal. Yes. So nicotine replacement therapy का यूज स्मोकिंग सिजेशन के लिए होता है बेसिकली, ताकि पेशेंट का जो स्मोकिंग का क्रेविंग है उसको विड्रॉ कर सकें. सो बेसिकली द आंसर इज स्मोकिंग सिजेशन. Says a nurse was given instruction to a postpartum mother of a newborn with hyperbilirubinemia. Which of the following is an appropriate instruction that should be given to a postpartum mother by a nurse? Yes. So the answer for this condition is to continue the breastfeeding every second hourly. Yes, we have to continue the breastfeeding every second hourly for this particular condition. The next question is question number 8. Which of the following drug causes red color urine? Yes, which of the following drug causes red color urine? सारे drugs दिए हुए हैं streptomycin, rifampicin, ethambutol and isoniazid. इनमें से कौन सा ऐसा drug है जिसको use करने से patient will get a red color urine? So the answer is rifampicin. Yes, rifampicin के लंबे use करने के बाद the patient will be having a red color urine. Basically, rifampicin drug is used to treat tuberculosis in many different parts of the body, and basically ये tuberculosis meningitis के case में this condition is used, and if the patient is using this drug for the longer time, red color urine is seen in the patient urine. The next question is question number 9, and it says that there is an image given and we have to find out that what kind of this image is, what kind of x-ray image is this condition of. So the answer for this condition, we can see the ribs and it is a chest x-ray, and so this condition is of pneumothorax. Yes, my friends, this condition of is of pneumothorax. Basically, pneumothorax क्या होता है? It is a condition of the collapsed lung. It is also known as a collapsed lung. In a pneumothorax, basically air leaks into the space between the lungs and the chest wall. Air जो होता है वो leak करता है between the lungs and the chest wall. Here we can see in the X-ray image the air space is present. So it is basically the image of pneumothorax. Pneumothorax is also known as a collapsed lungs. The next question, question number 10 says, identify the size of scalpel blade in the following image. Yes, in the image we can see there is a blade and we have to identify the number of the blade. So this blade is of 11 size. Yes, it is 11 number blade. Basically this 11 number का जो blade होता है, it is elongated triangular blade. It is elongated triangular blade and sharp along the hypotenuse edge with the strong pointed tip, making it ideal for a stab incision needed. ये stab incision के time में use होता है whenever there is a lancing of an abscess is required or inserting a chest drain. ये chest drainage के time में या any lancing of an abscess, it is used at that time. Basically, it is holded like a pencil from the often upside down by a surgeon to prevent it inadvertently being inserted too deep. इसको पेंसिल की तरह यूज किया जाता है lightly so that कोई deep insertion ना हो, कोई deep insertion mistaken से ना हो पाए. So the answer of this blade is it is the size of 11. Yes, ये 11 number का blade है. The next question number 11 says, what is the normal CVP pressure? Yes, what is the normal CVP pressure? Here the CVP pressure is central venous pressure. Yes, CVP pressure is known as central venous pressure and the answer is 2 to 6 mmHg. Yes, the answer is of normal CVP pressure is 2 to 6 mmHg. Basically, ये जो central pressure, venous pressure है, it is considered a direct measurement of blood pressure in the right atrium and vena cava. Basically, it is the measurement of blood pressure directly in the right atrium and vena cava. So, the normal CVP stands for 2 to 6 mmHg. The next question is question number 12. It says that identify the image given below. Yes, there is the image we can see and we have to identify that what is of this image. Yes, the answer is internal feeding bag. Yes, this image is of internal feeding bag and this internal feeding bag is a bag which is designed for the feeding purpose. Yes, it is a bag which is designed for the feeding purpose. Total capacity of this bag is 1200 ml and is connected to a nasogastric tube for the easy feeding in the patient. The very next question number 13 is identify the given condition in the image. Yes, we have to identify the condition which is given in the image. Yes, here we can see a picture and this picture represents that it is a gangrenous colon. We can see the colon in the outside surface and it is gangrenous. So it is known as a gangrenous colon. Question number 14 says silent MI is known as. Yes, silent MI is known as. The answer is diabetes mellitus. Yes, diabetes mellitus is a silent MI. Yes, the answer is diabetes mellitus. The next and the last question says, at which week mother feels the movement of the baby? Yes, at which week mother feels the movement of the baby? And the answer for this is 14 to 16 weeks. Yes, during the 14 to 16 weeks, mother starts feeling the movement of the baby. My dear nursing aspirants, if you haven't subscribed our channel, do like, share and subscribe APT online nursing classes for more further upcoming videos on paperback and your golden question series. Do like, share and subscribe it. Thank you.